The good news is our liver is a very forgetful organ, and it's also forgives you quite quickly. So, what happens if you stop drinking alcohol for 30 days? I get asked that often. Does your liver repair itself? Do you sleep better? Do you lose weight? Does your brain change? And surprisingly, very quickly, the answer is yes. But to be totally blunt, it matters how long you've been drinking and how dependent you are. So, if you drink heavily every day, need alcohol to feel normal, or experience shaking, sweating, anxiety, nausea, racing heartburn, if you stop, do not suddenly quit without medical advice. That's not the point. Going cold turkey is not all it's thought to be. Alcohol withdrawal can cause seizures, hallucinations, it's life threatening, and it's called delirium tremens or DTs. And you are not going to do that to yourself. For someone with alcohol dependence, the stopping should be medically planned, and this is not treated as an internet challenge. This is not an ice bucket. So, the first 24 hours, your liver begins cleaning the alcohol and its toxic byproducts. And it does that by doing the whole cleansing through your blood. You stop adding alcohol related calories to your diet and you begin to start to want to drink water and juices and not liquor. So you become more hydrated. Your urine will be more light in color. And when you wake up, uh, you sleep better, and the headache or the hangover or the so called dry mouth goes away. But you don't immediately feel amazing. I have so many patients with liver cancer that gave up alcohol and they didn't call me the next day and say, God bless you. I feel great now. That's not realistic. If drinking has become a part of your evening routine, you might feel restless, irritable, and tempted to drink as usual. Your friends will call you, they'll buy you your favorite cigar, and it is what it is. The other caveat is that alcohol will make you fall asleep faster, but it is not a normal sleep structure. So some people have difficulty falling asleep because the brain has adapted to so-called alcohol sedating side effects. So first few nights you may feel worse before sleep begins to improve. Uh, about 72 hours or so into it, you start noticing uh, this severe, again, uh, uneasiness. I've had patients who have seizures, hallucinations, and confusions, even severe shaking, and I always send them to the hospital and I tell them, go get help. Now, for people without dependence, the first week is just clear morning, little hangover, more energy, and eventually the digestive system gets used to it. Alcohol can irritate the stomach. If you have acid reflux or heartburn, it will mess up your intestinal flora. But once you get rid of it, the bloating and the digestive discomfort goes away. This is not an overnight transformation. Your body is simply adjusting, and your habits are adjusting too. By week 2 or 3, this is often when benefits become easier to notice. You sleep better and you're more refreshed, interestingly. And better sleep leads to better concentration, better reaction time, better mood, your appetite becomes more regular, and you feel better during the day. I've had patients tell me, Dr. Eson, I feel less anxious. And even though alcohol causes a temporary relaxation, which eventually wears off, the nervous system can rebound in the opposite direction and it will cause you to have anxiety, mood swings, and it produces restlessness as the alcohol leaves you. So, removing this poison will help, uh, and getting help to help yourself is very honorable. So, please do it. Your life will get better. You will get a break. Your liver will thank you, I promise you. It's a forgiving organ and it will cleanse itself. And during the abstinence, this overworked liver is going to go on vacation. And that's always a good thing. So, another thing you notice thrown around is non alcoholic fatty liver disease, alcoholic fatty liver disease, or better yet, fatty liver disease, which is swelling of the liver because of the damage you put it through. We get scientific, we call it cirrhosis. And sometimes a lot of this damage is not reversible, but it sure as heck is worth stopping alcohol so you don't make it worse. Typically, 30 days into it, all the observational studies of heavy drinkers without alcohol dependence have reported insulin resistance improvement, blood pressure improvement, liver function improvement, and ultimately body weight normalization. The average reduction included approximately 26% uh, in a measure of insulin resistance, 7% in blood pressure, and 1.5% in body weight. Uh, Now, again, this is not a guarantee. And weight loss depends on whether or not you stop drinking alcohol and you just have lots of donuts. So that's not going to help us. Now, your resting heart rate and blood pressure will improve, especially if you're a heavy drinker. Your skin is going to look less dry. Your eyes look less puffy. You'll be prettier. That's nice. You'll be in more control of your trigger, stress, boredom, social pressure, and all and all and all. And the lifetime risk of getting liver cancer does not disappear, but it's definitely less. And the cirrhosis does not magically vanish, but it's definitely better. So, to make the long story short, stop drinking. Do it right. Get help. Improve your sleep. Improve your insulin. I sure as heck don't want to treat you for liver cancer. And the real question is, can you stop drinking for 30 days? believe it or not, you can. I cannot tell you the number of patients that end up in my office and they say, why didn't anybody tell me this sooner? And I tell them, guess what? I just did. That was your last drink. Anyhow, I hope you have a wonderful evening. If you're not a drinker, don't start. If you do drink too much, get help. And you can do this because I do not want to treat you for liver cancer. Have a wonderful rest of your evening.